Welcome to this explainer. Today, we're going to explore something that honestly sounds almost too simple to be true. For years, the conventional wisdom has basically been that anxiety is this intense battle you have to fight, right? You fight it with medication or targeted therapy or just sheer willpower. But recently, a growing body of clinical research is asking a much quieter and I think much more fascinating question. What if simple, very specific sounds could physically calm an anxious nervous system without you needing to use any willpower at all?
I mean, it really sounds unbelievable, doesn't it? Just imagine this, a controlled clinical study where researchers hook people up to cardiovascular monitors. They're tracking their heart rates while these participants just watch a video of someone whispering and gently tapping on a microphone. And what happens? Well, their hearts literally slow down. And we're not talking about some trivial, barely there blip on a screen. And it's not because they fell asleep either. Their nervous systems measurably shifted right out of a state of stress and into a state of profound calm, right there on the chart. Okay, let's dive into this, because that heart rate drop wasn't just a fluke. The research actually shows an average reduction of about 3 beats per minute. Now, to put that into perspective, in the clinical world of cardiovascular monitoring, a consistent 3-beat per minute drop just from listening to a sound, that is a massive, measurable biological shift. It proves beyond a shadow of a doubt that this isn't just all in people's heads, it is physically happening in their bodies.
So, here's our roadmap for this explainer today. 1. The sound of calm. 2. Flipping the nervous system. 3. What the science says. 4. Benefits and limitations. And finally, 5. Try it tonight.
Let's start right off with Section 1, the sound of calm, demystifying the phenomenon.
Because before we get into the heavy neuroscience, we need to unpack what this slightly weird but deeply fascinating internet phenomenon actually is. ASMR. It stands for Autonomous Sensory Meridian Response. Basically, it's defined as a deeply relaxed, mildly euphoric state triggered by specific sounds or visual cues. We're talking about triggers like super soft whispering, slow, deliberate hand movements, gentle tapping, or even these personal attention scenarios, like watching a pretend haircut or a mock eye exam. And for a lot of people, these triggers create a literal physical tingling sensation. It kind of starts at the scalp and washes all the way down the neck and the spine. But you know what? For others, there are no tingles at all. It's simply a massive wave of calm. And when clinical researchers are looking at ASMR for anxiety, it's exactly that wave of calm they're zooming in on.
Which brings us nicely to Section 2, flipping the nervous system, the biology of calm.
And this brilliantly illustrates the core biological mechanism at play here. At its very core, anxiety is a physical state where your body is just stuck on high alert. Your sympathetic nervous system, that's your ancient, built-in fight or flight branch, is switched entirely on. So to find any kind of real relief, relaxation tools have to literally flip the switch over to the parasympathetic nervous system. That's our body's rest and digest state. So how exactly does watching an internet video of someone gently tapping a hairbrush flip that biological switch? Well, it happens through the feeling of being gently and safely cared for. Think about it. That very specific sensation of being the absolute focus of someone's calm, unhurried attention. That is deeply wired into our human evolutionary biology as a major signal of safety. What ASMR content does is it artificially recreates that exact signal of safety. And for a huge number of people, the nervous system responds just as if that careful attention were happening right there in the physical room with them. It just settles.
Let's transition over to Section 3, what the science says, the clinical evidence. Because, hey, you don't have to just take my word for it. The scientific validation for this has grown incredibly fast. The real foundational study happened back in 2018, published in PLOS ONE by researchers at the University of Sheffield. This was the one that first confirmed that super reliable 3-beat per minute drop in heart rate alongside people actively reporting feelings of calm. Fast forward a bit to 2023, and a study in fNIRS in biomedical technologies confirmed those significant heart rate drops again after just a single session. But it gets really mind-blowing in 2025. A study in the European Journal of Neuroscience used some very advanced brain imaging, specifically functional near-infrared spectroscopy, or fNIRS for short. They actually looked inside the brain and found that ASMR effectively reduced activity in the prefrontal regions that we associate with anxiety. And it did it way better than a standard control video. So we've literally moved from just tracking heart rates to physically watching the anxious human brain quiet itself down on a monitor. Wild, right? Now, what's really interesting about this slide is this gold standard data from a 2022 randomized controlled trial published in Scientific Reports. They took 76 people and matched ASMR up against binaural beats. But they didn't just have them listen once and call it a day. They actually built a routine. Participants listened for 15 minutes during the day and then 30 minutes right before sleep for 3 solid weeks. And the results? Well, it wasn't just some fleeting in-the-moment calm. These people showed significant improvements across multiple symptoms. Perceived stress, depression, insomnia severity, and state anxiety, all of them dropped. It essentially proved that structured daily use yields some incredible multi-symptom benefits.
Moving right along to Section 4, Benefits and Limitations, a clinical reality check.
As promising as all that data is, if we're going to follow the science impartially, we absolutely have to be honest about the limitations. We have to acknowledge what we know and, maybe more importantly, what we still don't know. The clinical studies we currently have, they're mostly quite small, often involving fewer than 100 people. Plus, the vast majority are really just measuring short-term effects, basically how someone feels right after they finish listening. And crucially, there are currently 0 massive, large-scale clinical trials establishing ASMR as a standalone cure-all treatment for severe anxiety disorders. But on the flip side of those limitations, the data also makes it incredibly clear that ASMR is entirely free, and it has essentially 0 negative side effects.
And there's one other huge variable here. You. A 2025 naturalistic fMRI study published in the Journal of Medical Internet Research showed that biological responses vary enormously from person to person. Just look at this breakdown on the chart. Roughly a quarter to a third of people simply do not get those physical tingles at all. But if you fall into that 33%, really, don't worry about it. The research clearly notes that even without the tingles, many non-responders still report significant, measurable feelings of calm. Your nervous system can absolutely still benefit.
Oh, right, Section 5, Try It Tonight, your actionable guide.
So, knowing all this amazing science, how do you actually apply it to your life? Let's move to and see how this builds into an effective daily routine, step by step. Step 1. Headphones are completely essential. A lot of ASMR is actually recorded in 3D space, so pop them on, but keep the volume low and conversational. Step 2. Start with personal attention triggers. Look for soft speaking, maybe a pretend checkup, or slow hand movements, things that heavily signal safety to your brain. Step 3. Give it time. The science shows that the parasympathetic shift, that actual drop in your heart rate, really builds over the first 10 to 15 minutes, so don't just quit after 2 minutes. Step 4. Use it proactively. Remember that 2022 RCT data we just looked at? The biggest multi-symptom benefits came from daily listening, not just throwing it on when you're already in a full-blown state of panic. And finally, step 5, monitor your own response. If a certain sound, actually annoys you or increases your anxiety, just scratch that. Switch creators or find a completely different trigger.
Now, the absolutely crucial takeaway here is safety and context. ASMR reliably slows the heart, and as we've seen, it visibly quiets the anxious brain on an fNIRS scan. But as the researchers make abundantly clear, it is a low-risk companion to therapy and medication. It's not a replacement. If your chest is tightening up, it's an amazing, totally free, side effect-free tool to reach for. But it's always meant to be complementary to, not a substitute for, proper professional medical care.
So we've seen the 3 beat per minute drops, we've looked at the brain scans, and we've walked through the multi-week trial results. The science here is genuinely encouraging, officially shifting this from just some quirky internet oddity to a real, clinically validated tool for biological calm. So I'll leave you with this thought. Knowing what you know right now about your very own parasympathetic nervous system, how will your nervous system respond to the sound of calm tonight? Go grab some headphones, test the science out for yourself, and just see what happens. Thanks so much for joining me for this explainer.